Hello, my name is Dr. Amir Bashir. I'm a consultant psychiatrist, London Psychiatric Clinic, Harley Street, London. And today I'm going to talk about post-traumatic stress disorder. Post-traumatic stress disorder is a type of anxiety disorders which has three types of symptoms which develop after the person is exposed to traumatic event. In the other anxiety disorders, the focus is usually the fear in the future, whereas in post-traumatic stress disorder, the person is affected by thoughts about threat that had taken place in the past. PTSD occurs after the person is exposed to an extreme trauma. However, this could be just witnessing an event that involves threat to physical injury of another person. The person responds to trauma by intense fear and helplessness or horror. The first set of symptoms are namely flashbacks, nightmares, and intrusive thoughts, and they all three are associated with persistent re-experience of the traumatic event. The second set of symptoms involve persistent effort to avoid any cues associated with trauma. Then there is persistent high level of anxiety. All those symptoms must be there for more than 1 month. And symptoms must be significantly affecting various aspects of life in order to fulfill the criteria of post-traumatic stress disorder. During World War I and II, stress-related symptoms were named as shell shock and battle fatigue. 9 to 10% of women and 3 to 4% of men develop PTSD in lifetime. Out of those who are exposed to the traumatic stressors, the chances of developing PTSD is more in females and who have neurotic traits or who have less support in society or people with the previous psychiatric problems and those who have family history of psychiatric illness. Many people will experience traumatic event, they get nightmares and intrusive thoughts about the trauma and so forth. It's normal to have those, but often they disappear within a few weeks' time. For PTSD, they had to continue for at least 1 month. A specific treatment of the PTSD is psychological. It's called trauma-focused CBT, and it involves exposure to trauma. It's just like watching a horror movie again and again. Decreases the fear associated with it. EMDR is abbreviation of eye movement desensitization reprocessing. And this treatment requires the patient to evoke the memory of the trauma while at the same time moving the eyes back and forth, following the moving finger of the therapist. Psychiatric medicine, including antidepressants, are commonly used in PTSD, although the evidence is not adequate to support their use. Thank you very much for listening this short introduction of post-traumatic stress disorder.